Well, it started in the morning. I was just getting ready for work and was feeling lightheaded and a little off. And I tried calling for my wife because I knew something was wrong, and nothing was coming out. And she came upstairs to see what was taking me so long, because I'm normally gone. And she asked what was wrong. My face was drooping on the left side, and my wife noticed that something was wrong and rushed me to Franciscan Health here.
So he came in with left-sided weakness, and he is a relatively young man for this particular problem. And so time is of the essence when you have that.
They immediately diagnosed me as having a stroke, and we're in talks right away with Northwestern Hospital.
So Jonathan came in here, we identified a significant large vessel stroke, and what we did was contact Northwestern. We were in the process of partnering with Northwestern for Telestroke. And the benefits of doing this is you can do a lot more, or far more now, with intracranial interventions than we could do 5 to 10 years ago. What happens is the neurologist will actually, you'll see his face, his or her face on the screen, and they will ask the patient to follow commands and do very specific things for neurologic evaluations. And the neurologist interacts with them directly.
I was a little shocked, because at first I know my wife had asked, "Is he have to stay overnight?" And they go, "Yes, but not here." That's when they said they're talking to doctors at Northwestern and trying to figure out what's going on. They said, "We're sending information over to them," and I'm like, okay. Once they said, you know, it's the best choice for you right now, where to go, and we think it's the best thing, and my wife's like, okay, let's do it then.
We get the CT, we get a CTA back on him. Notice he's got a large vessel occlusion. They reviewed the films and they said, we think we can help him. So we transported Jonathan from Franciscan Health up to Northwestern.
They were, as soon as I arrived, they were ready. The nurses knew who I was and what was going on, and they got me ready for, I was in surgery probably 10 minutes after arriving at Northwestern. I mean, there was no delay, which was, they said was part of my quick recovery.
So what happens is it is 100% their show once he's at Northwestern. And it's why we partner with them. They have the expertise in this area. We want them to manage that patient. That is, and they're the experts in that area. They do any procedures that they think are necessary on him to improve his long-term outcome, and then they set him up with rehab.
Everybody explaining everything along the way and what was happening to me and what they were doing to resolve what was happening just put my mind at ease, my wife's mind at ease, which is a huge deal, especially in that kind of situation.
And then once they've done any intervention they can to help him and have stabilized him and set him up for rehab, they bring him back here so we can rehabilitate Jonathan at Franciscan Health.
I was told that if they wouldn't have reacted so, I would probably have side effects and it would have been longer lasting than it was. I think that everybody's quick reaction to helping me recover from, between that and the physical therapy, I recovered quite quickly. So I was back to work the week before Christmas.
So the technology has allowed us to really change that. Northwestern has been on the cutting edge of this, and it's great for Franciscans to have the opportunity to partner with them.
I think if Franciscan Health and Northwestern weren't working so closely together, I don't think I'd have been back to work and back to myself so quickly. Coming together is the beginning. Keeping together is progress. Working together is success.